Good morning everyone. We will continue the topic nutrition competition number 8.5. Today we are studying cause, effects and health risks associated with overweight, obesity and metabolic syndrome. So overweight, obesity and metabolic syndrome are nearly similar conditions. First we will see what is overweight, what is obesity and metabolic syndrome. Then we will study their causes, effect and health risks. These conditions are nowadays gaining more and more importance. You can find out from this fact. If you see global scenario, as per 2022 data, 43% of world adult population is overweight and 30% of world adult population is obese, and 20% of the world children and adolescents population is either overweight or obese. So to understand these three conditions, you should know body mass index. So body mass index is nothing but it is a ratio of weight of a person in kg to the height of a person in meter square. So it is also called as BMI. So BMI is equal to weight in kg by height in meter square, and unit is kg per meter square. The normal range of BMI is 18.5 to 24.9 kg per meter square. If the BMI of a person is below this 18.5, then we call it as a undernourished, and if it is above 24.9, then we call them as a overweight or obese person. So depending upon the BMI, we have two categories: overweight and obese. Overweight means when BMI is from 25 to 29.9 kg per meter square, whereas obese means when BMI is 30 or above 30 kg per meter square. Depending upon the BMI, the obesity is further divided into grade 1, grade 2 and grade 3 obesity. BMI of grade 1 obesity lies between 30 to 34.9 kg per meter square, whereas BMI of grade 2 obesity lies between 35 to 39.9 kg per meter square. BMI of grade 3 obesity is 40 or above 40 kg per meter square. After studying overweight and obesity, we will see also metabolic syndrome. What is metabolic syndrome? Metabolic syndrome is nothing but it is a cluster of different conditions which affect the health of individuals. Means in the metabolic syndrome, single condition is not there, but many conditions will present in the same individual. Then we call them as a metabolic syndrome. Now, which are these conditions? These conditions are like abdominal obesity, insulin resistance, dyslipidemia, elevated blood pressure, overnutrition and sedentary lifestyle. So few of these conditions when present in this not necessary that all conditions should be present in metabolic syndrome. If few conditions are also present, then we call it as a metabolic syndrome. Now we will see the criteria, WHO criteria for metabolic syndrome, or how WHO say, or how WHO define metabolic syndrome. First, according to WHO, to call a person of metabolic syndrome, he should have insulin resistance. Now what is meant by insulin resistance? That is also defined by WHO. So if a patient have type 2 diabetes mellitus, then he is a insulin resistant person. Or fasting blood glucose level of a person is more than 100 milligram per deciliter, then also according to WHO he is a person of insulin resistance. Or a person is having impaired glucose tolerance. So if any of these three conditions present in an individual, then you call him as a insulin resistance. Now what is impaired glucose tolerance? For this purpose you have to see this chart. Here WHO have given guidelines for the diagnosis of diabetes mellitus. So if you see this chart, fasting blood glucose is less than 110 milligram per deciliter in normal person, but if it increases above 126 milligram per deciliter, then we call him as a diabetic person. Similarly, post meal or post prandial blood glucose, which is measured after 2 hours of meal. Then in normal person, this blood glucose level should be less than 140 milligram per deciliter. But if this blood glucose level is more than 200 milligram per deciliter, then we call him as a diabetic person. So fasting blood glucose normal 110 and diabetic more than 126. The fasting blood glucose lies between 110 to 126 is called as impaired glucose tolerance. Similarly, the post meal blood glucose less than 140 is normal, whereas more than 240 milligram per deciliter is diabetic. And the post meal blood glucose level between 140 to 200 milligram per deciliter is considered as impaired tolerance. So coming to our WHO criteria of metabolic syndrome. So insulin resistance we have completed. Any of these three conditions is present in an individual, then we call him as a patient of insulin resistance. Now along with insulin resistance, two more things a person should have to call him as a patient of metabolic syndrome. And these two conditions may be from the following conditions. First, hypertension. If a person is having blood pressure more than 120 by 90 millimeter of mercury, then we call him as a hypertension. Dyslipidemia. If a person lipid profile is disturbed, which can be defined by if the triglyceride level is more than 150 milligram per deciliter, or HDL cholesterol is less than 40 milligram per deciliter for men and less than 50 milligram per deciliter for female. If the BMI of that person is more than 30 kg per meter square, or waist to hip ratio of that person is 0.9 for men, more than 0.9 for men and more than 0.85 for the females. So along with insulin resistance, if any of these two conditions is present in an individual, then we call him as a person of metabolic syndrome. Coming to the waist to hip ratio, in the recent year, waist to hip ratio is considered as reliable marker of obesity. Waist circumference and hip circumference is measured by simple tape and their ratio is taken, and the normal range of this ratio is less than 9 for men and less than 0.85 for female. And it is observed that waist to hip ratio is more effective in predicting the heart disease. Now after seeing these three conditions, we will come to the causes of these three conditions. The causes of all these three conditions are same. First is dietary factors. Excess intake of calorie means taking calories which excess than the need of the body. High consumption of processed food. Processed food means packed food, which is readily available in the packets, which need not to be cooked, directly eaten. That type of food is called as processed food. Such foods are generally having high amount of salt and high amount of trans fat, because this trans fat on storage does not give unpleasant smell and taste to that food. Therefore trans fat is generally used for preparing this processed food. Sugary beverages consumption like soft drinks, fruity juice, etc. Low intake of fibers. So these are some dietary factors. Next is sedentary lifestyle. The main cause of sedentary lifestyle in new generation, especially among the children and adolescents, is they lack awareness about the benefits of physical exercise. Second, excessive use of screen time like mobiles, TV, video games they are using, therefore their physical activity decreases. Overuse of automated vehicles. Automated vehicles may be any two-wheeler or four-wheeler, which can be operated on their own. Therefore, they are called as automated vehicles. If you want to go 100-meter or 50-meter distance, then also we are using automated vehicles. So this also decreases the physical activity. Next cause is genetic and biological factors. In some individuals, there is genetic predisposition for obesity. There is a strong evidence that if both parents are obese, then chances of child becoming obese is 75%. So genetic causes are definitely there in obesity. There are some diseases which leads to obesity, like hypothyroidism. Hypothyroidism means decrease T3, T4 thyroid hormone levels in the blood. Thyroid hormones are essential for maintaining the basal metabolic rate. In the last lecture, we have seen that we spend energy for BMR. If the BMR is less due to deficiency of thyroid hormone, the energy expenditure is also less, and that energy is stored in the form of fat in the body, which leads to overweight and obesity. Next cause is polycystic ovarian syndrome. This is also very common disease among the females nowadays. Psychological factors. Emotional eatings. Emotional eating means eat without need, or there is increased appetite without need, and this may be due to stress when the person is in stress, or if he is anxious or anxiety, depression, sleep deprivation. So all these factors leads to increased appetite, which is called as emotional eating. Nowadays, one more cause is found, which is called as leptin. So first we will see what is leptin. Leptin is a hormone which is considered to be as body weight regulatory hormone, or it will regulate our body weight. It is synthesized by OB gene present in the white adipose tissue. There are two types of adipose tissues present in our body, white adipose tissue and brown adipose tissues. The function of white adipose tissue is to store fat, and the function of brown adipose tissues is to generate heat. So this leptin is synthesized by white adipose tissue. When adequate fat is present in adipose tissues, means white adipose tissues, then leptin levels are high, means they will secrete more leptin, and that leptin prevent further feeding and deposition of fat in the adipose tissues. So leptin is basically a weight regulatory hormone which does not allow excess fat deposition. At the same time, leptin stimulates lipolysis. Lipolysis means breakdown of the stored fat in the adipose tissue, and inhibit lipogenesis, means if leptin is secreted, then it inhibits further fat deposition, that is inhibit lipogenesis. Genesis means synthesis of fat, mainly triglycerides. Now, if there is any defect in the leptin hormone or its receptor, leads to overeating and obesity. So if leptin is synthesized in a normal quantity, then the chances of obesity are less, but if there is defect in the leptin synthesis or its receptor, then it leads to obesity. Nowadays, treatment of obese person with leptin hormones reverses the obesity. So this is the leptin. One more correlation is that complete absence of brown adipose tissue. Now, I have told you previously, brown adipose tissue, the main function is to generate heat. This brown adipose tissue is located in the thoracic region. It stores less fat. It is metabolically more active. It is found in newborn. It contains high proportion of mitochondria and cytochromes and less ATP synthase. So, due to presence of cytochromes, electron transport chain is going on in the mitochondria of brown adipose tissue, but the ATP synthase, which is the fifth complex and which actually synthesize the ATP. That enzyme is deficient, or that enzyme is present in less quantity. Therefore, when electron is transported through the electron transport chain, it releases energy, and that energy cannot be fully converted into ATP, and that energy is lost in the form of heat. At the same time, a protein called thermogenin is present in the inner mitochondrial membrane of mitochondria of brown adipose tissue. This thermogenin act as a uncoupler of oxidation and phosphorylation. That means oxidation takes place in electron transport chain and phosphorylation takes place in ATP synthase. That is fifth complex, chemiosmotic theory. So normally what will happen? Electron is transported through the electron transport chain. At each step it will release energy, and that energy is utilized by ATP synthase for ATP synthesis. But here the thermogenin will separate these two processes, oxidation and phosphorylation. Means electron transport chain and ATP synthesis are separated. Therefore it is called as uncoupler, and therefore the energy, again the energy, whatever energy release from electron transport chain is not converted into ATP, and it is lost in the form of heat. So mitochondrial oxidation produces more heat and less ATP. Individuals with brown adipose tissue in their body liberates more heat, and hence they do not become obese. Now we'll see the effects of these three conditions. First is physical effect. Individuals are less physically active, they have joint pains, they have discomfort in moving. Metabolic changes includes insulin resistance, just we have seen, risk of having diabetes mellitus, hormonal imbalance is also seen, and this hormonal imbalance may leads to disturbance in the reproductive health of that individual. Emotional and mental effects include such persons are less expressive, either they are in depression or in anxiety. Frequent mood alterations are common in such individuals, I mean changing mood changes. Now coming to the health risks. First, cardiovascular disease. As the persons are having high blood pressure, that is hypertension, then these persons, due to presence dyslipidemia, have more risk of developing atherosclerosis. So hypertension and atherosclerosis increases the risk of coronary artery diseases, and this coronary artery disease leads to cardiovascular disease. Next is type 2 diabetes mellitus. Due to insulin resistance, impaired blood glucose level or high blood glucose level is seen, and this will lead to type 2 diabetes mellitus. Reproductive issues, just now we have seen, due to hormonal imbalance, infertility may be seen. Overweight in women leads to polycystic ovarian syndrome. Respiratory issues include increased risk of sleep apnea. Apnea means breathing temporarily stops for some time. So this is sometimes it is a very dangerous situation. The next is asthma, narrowing of the bronchial tree, so that entry and exit of air is decreased. Next effect is gastrointestinal diseases. Increased risk of acid reflux, that is gastroesophageal reflux disease. Such persons have frequent complaints of heartburns due to regurgitation of acids from stomach into the gastroesophageal junction. Such persons are having more risk of developing gallbladder diseases like gallstones. Now coming to treatment, just now I have told you nowadays leptin is given to the persons of low obesity, which may reverse the obesity. Olestra is also a useful It is a artificial lipid. It tastes like lipid, but it is not absorbed from GIT and excreted as it is. Now, Atkinson diet is also advised by some person, but it is controversy. So in this diet, low carbohydrate is given to the person, means less than 50 grams of carbohydrate should taken by the person per day. Therefore, the main source of energy for our body is carbohydrate, and which is limited to 50 grams. Instead of that, high fat and high proteins are given to the person. So when carbohydrate is not available, naturally body will obtain energy from fats and proteins. When the fats are broken down, they will form ketone bodies. Now, one more advantage of this fat intake is when a person take fat in the diet, more fat in the diet, it leads to reduce appetite, and when appetite is reduced, his food intake is also reduced. And as I have told you that when fat is utilized for energy, ketone bodies are formed in the body, and these ketone bodies are largely excreted through the urine. That means the fat which we have taken in the diet as well as the fat which is present in our body is utilized for energy purpose. And when this fat is utilized for energy purpose, ketone bodies are formed, and when these ketone bodies moves from one organ to other organ through the blood, they get filtered through the kidney and excreted into the urine. That means fat is lost in the form of ketone bodies. So this is the concept of this diet. So this is the case which is asked on this topic. A 65-year male with sedentary lifestyle, had abdominal obesity, high BMI, increased blood pressure, elevated serum triglyceride level, and reduced HDL. What is the diagnosis? Support your diagnosis and how this condition is reversed. So diagnosis is metabolic syndrome. For support, you have to write down the WHO criteria. This is the WHO criteria for diagnosis of metabolic syndrome that we have already studied. Next, how this condition is reversed? We have to reverse the causes, like sedentary lifestyle should be changed, balanced diet should be taken, adequate fiber should be taken, exercise should be done, smoking and alcohol intake should be avoided, and we have to live stress-free life. So this is about overweight, obesity and metabolic syndrome. Thank you very much.